Let's talk just about smoking. Reasons to quit smoking. Approximately 50 million people, or 20% of US adults, smoke, and almost 500,000 people die every year from the United States from tobacco-related diseases. So if you smoke, you got a lot of company. And over 16 million people are living with a serious illness caused by smoking. In the United States, on our cigarette packages, you get very nice things. The Surgeon General has determined that smoking is hazardous to your health. Well, look what other countries write. Smoking causes fatal lung cancer. Smoking kills. Smokers die younger. Smoking can cause a slow and painful death. Smoking clogs the arteries, causes heart attacks and strokes. They're not giving you a benign message like we are. But here in the United States, when they wanted to put these messages, Congress said, oh, that's being too mean. We can't do that. It's too scary. So we get the benign messages. The average smoker loses 22 years of their life. So what 22 years do you want to give up? With your child? With your grandchild? Pick what 22 years of life do you want to give up? If you smoke, you stink. It's that simple. And not just when smoking. It saturates your hair, your clothing, your car, your home, your office. And there's no mint on this earth that can fix your breath. There's no cologne that can cover the smell of your smoke. Oh, you want wrinkles? Continue smoking. Absolutely. The chemicals in smoke impair your body's ability to repair the skin damage caused by those UV rays. Oh, and did you know that if you smoke, you're not going to feel as rested as a non-smoker after a whole night's sleep? Yellow fingernails, anyone? Without putting on polish? How about yellow fingers? Do you like that from holding cigarettes? Oh, you're going to vape instead. Okay, how about yellow teeth? All right, giving up the yellow. But did you know whether you vape or you smoke, you have more plaque buildup than a non-smoker? You get gingivitis and bone loss in your jaw. You want to lose your teeth at a younger age? Yeah, you want dentures? Or you want to have huge expense of having to get dental implants? You know how much those are per tooth? A lot of money there. You got that money? This is the amount of tar in your lung after 2 years. There's a lot of tar. Although your lungs will start clearing tar after 12 hours without smoking, it's going to take you 90 days for you to improve your lung function and your circulation. 3 months for you to quit smoking before your body's pulmonary function and circulation are anywhere close to normal. Did you know smoking causes depression? It's not the other way around. Smokers are more than twice as likely to be depressed, and as you age, the rates of depression go up. And smoking does not increase as a result of depression. Okay, so if you look at folks who are depressed, the incidence of smoking does not go up. And if you're smoking, you might as well be burning money. The cheapest state in the United States right now sells a pack of cigarettes for $6. The most expensive state is somewhere between $12 and $15. The average in the United States right now is $10. So if you smoke a pack per day, that's over $3,600 a year, which, assuming the cost would stay $10 for your entire life, that would be over $183,000. But, cost of cigarettes would go up over your lifetime. So, you're looking at over 200 grand. Do you think maybe you might want to put that on a house deposit? And that doesn't include your healthcare costs or your mints or your dry cleaning or anything else. So I already talked about how smoking causes an increase in heart rate and your vasoconstriction, and your heart has to work twice as hard while your blood pressure is elevated. Oh, look at these cigarettes. Stopping smoking reduces the risk of fatal heart and lung diseases. Yeah, some cigarettes say that. In Europe, not here. If you're a smoker, your atherosclerosis is 50 times. It's twice as rapid. If you quit smoking, it's still 25% more. And if you're a secondhand smoker, it's 20% more. If you just live with a smoker. So smoking not only clogs your arteries, it's going to cause heart attacks and strokes. If you live with a smoker, your risk for heart attacks and strokes goes up. So you have 3 times the risk of coronary heart disease causing a heart attack or angina, twice the risk of having a stroke, 10 times the risk of peripheral vascular disease. Smoking is the #1 cause of peripheral vascular disease. So now that is in 5% of Americans, causing toe or foot amputations. Yes, this was a proposed warning, which got voted down because it was thought to be too gross for Americans to handle. Smoking causes impotence. Current former smokers are 30% more likely to be impotent. So if you want a good sex life, don't smoke. 1 pack per day smokers are 60% more likely to be impotent. Ladies, PMS. Smokers are twice as likely to have PMS, and the younger you smoke, the younger you start smoking, the more severe. If you start as a teenager, oh my goodness. Also, ladies, if you're smokers, the more you smoke, the more you vape, the higher the likelihood you have of irregular cycles. And smokers who are on oral contraceptives, on the pill, the patch, any of those things, you have 50% more chance of spotting between your periods. In other words, your smoking screws up your birth control. Remember how I talked about how smoking makes you lose your cilia? Ladies, did you know you have cilia in your fallopian tubes? And yet those cilia in your fallopian tubes are important for getting that little egg to meet up with the little sperm and then moving that fertilized ovum into your uterus for a pregnancy. Well, you don't have the cilia there, so you have 4 times the risk of having an ectopic pregnancy, having that pregnancy be in your fallopian tube. And prenatal exposure. Ladies, if you are smoking while you are pregnant with a female baby, you are affecting the fallopian tube of your female baby. And you are causing decreased fertility of your female children. So yes, you are affecting your female children. Oh, gentlemen, I haven't forgotten about you. Your smoking decreases your sperm count. Not only that, whatever sperm you do have, you're causing DNA damage in this. So you're getting genetic mutations. Why do you think we have so much more infertility these days? So you're going to be less likely to fertilize. Hope you're saving up $10,000 for IVF. Oh, and by the way, if she doesn't smoke, but you smoke and you give her oral sex, your oral sex is killing her cilia. So you've increased her risk of ectopic pregnancy, and you're giving her prenatal exposure, affecting her fertility and her female children. And ladies, if you are pregnant, stop smoking. Stop smoking before if you want to get pregnant. If you're smoking or vaping while you're pregnant, you are decreasing your oxygen flow to your baby by 25%, causing lower birth weights, more birth defects, and 50% more premature births. 50% more premature births in smoking women. All right, so I did all that high blood pressure, all that kind of stuff. So let's talk about diabetes and smoking. Occasional vaping and secondhand smoke, 10% greater risk of diabetes. Regular vaping and secondhand smoke, 16% risk of diabetes. More than one pack per day, twice the risk of diabetes. Oh, and by the way, children imitate their parents. 50% of smokers' kids are going to smoke. And by the way, did you know that if you smoke, your children are going to be less active and going to have worse nutrition than a non-smoker's child? And not only is your smoke annoying, it's killing other people too. Yeah, this got voted down too. This was a great study done in Australia. Okay. Every roommate and dating form asks if you're a smoker or non-smoker. So in Australia, they did a great study looking at dating apps and looking at responses to those who were smokers versus non-smokers. Non-smokers got a ton more hits than smokers. So if you want to get the right kind of a swipe, quit smoking. All right. As you know, smoking causes fatal lung cancer, causes all other kind of cancers, which are slow and painful deaths. Look at all these other kind of cancers. You know why pancreatic cancer is so common now? Because of smoking. How about all these other chronic diseases that are not cancers? So here's my final message to the non-smokers. It's highly addictive. It's like crack. Don't start. And with the reproductive system, thank you so much. And hopefully I will see you again. Thanks for all your hard work.